right, hello everybody. Hope you're having a great Monday. I am Dr. Heather Moore, owner of Total Performance Physical Therapy. We are going to be talking about sciatica. Seems to be running rampant right now with everybody being more sedentary, working from home, not really being at desks that they need to be at. So we are going to talk about immediate relief for sciatica pain. Before I go into what we can do for sciatica pain, it's really important that we discuss sciatica and what it is. So sciatica is actually a garbage can term. And I say that, and I know everyone's like, oh, but that's what I've been diagnosed with. Sciatica just means pain going down the leg, okay? And it's called sciatica because there's a sciatic nerve that runs down your leg. So here's kind of your tailbone. Here's you're looking at you from behind. Here's your muscles. There's a big nerve that goes all the way down your leg into your foot, and that is your sciatic nerve. So whenever you're diagnosed with sciatica, it is important to know that that basically just means there's pain going down the leg. It doesn't tell you why, and that's where a lot of times the cures and whatever you're doing fail because you don't have the proper cause. There is no one cause or cause for sciatica. It can be caused by one thing, it could be caused by multiple things. In treating sciatica and getting to the bottom of it and making sure it doesn't come back, you've got to figure out why is it there in the first place? What's going on? So sciatica could mean that you have a herniated disc, all right? Because a herniated disc can send pain all the way down your leg. Now, when we're talking about a herniated disc, we use the word herniated, we use the word bulging, all meaning the same thing. All right, so a herniated disc can cause that pain going down your leg. When we're talking about pain going down your leg, we're talking about numbness and tingling. It can go to the back of your knee, it can go to your quad, it can go all the way into your toes, leaving you with some numbness and tingling in your foot. So that can be the herniated disc can be causing some of those sciatica symptoms. However, if you are like 80% of Americans, you have a herniated disc in your back. And a lot of times when we look at you and we get our hands on you and we realize that that herniated disc really isn't causing the sciatica pain. It may be a component, it may not be, but usually it's more than just the herniated disc. We often bring up the herniated disc, and often people are diagnosed with herniated disc because it's one of the only things that shows up on the MRI when you're dealing with back pain and when you're dealing with sciatica. A lot of the things that we're going to talk about going forward don't really show up. So you need to make sure that you are aware that there are several different causes. And when I say, okay, there's immediate relief, I'm going to show you something that's going to take care of a lot of nerve pain that will just come if you have a herniated disc. If that's not one of the factors why you have sciatica, it's not going to do anything for you. So it's really important to determine the cause. I say this in all of our videos. You can look them all up on our YouTube channel, Total Performance Physical Therapy. It is so important to determine the cause because you have to figure out what's going on, where it's coming from, in order to be able to treat it effectively. The one-size-fits-all cure isn't always the best because if it's coming or if you have a different cause than somebody else, the treatment's not going to work. So the first reason is a herniated disc. Second reason we have sciatica is usually a muscle imbalance. So a muscle imbalance, and it's usually in your glutes, in your back somewhere. You're going to have knots, trigger points. So basically, as your nerves are running down into your leg from your back, your glutes, things like that, the muscles will get tight. All right, and they'll actually start to compress these nerves. And you'll get that numbness and tingling. You'll get that pain. If you have a pain in the butt, a lot of times that can be referred to as sciatica. That's really piriformis syndrome. But that's just the piriformis getting tight and causing pressure right there. So as these nerves get irritated, as that muscle gets smaller and smaller and starts to really push against the nerves, it's going to send pain and numbness and tingling down that leg. Now, the tricky part is what muscle is imbalanced? Which muscle is tight? Which muscle is causing it? I don't know. That's where we have to get our hands on you and figure it out. That's where I say sciatica is really difficult to a lot of times diagnose because where is it coming from? What muscle is it coming from? Is it coming all the way up in your back? Is it coming more from your leg? Is it coming from your glute? what's going on. But left ignored, it can really cause some issues. You never want to ignore any sort of numbness or tingling. That is a sign that there's a nerve involvement. Nerve controls our muscles, so you really want to be careful with kind of saying, oh, it comes and goes, or it doesn't really bother me. When sciatica first starts, it generally comes and goes. You're not going to feel it all the time. It's not going to be painful to the point where you can't do anything. You're usually going to be able to work through it, but it's really important to know that will get much, 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 much worse. And the sooner you get it fixed, the sooner you're going to be able to get back to what you enjoy doing. Chronic back pain doesn't come from massive accidents. Chronic back pain, and these stories you hear, people just getting injection after injection, comes from people ignoring back pain for years. And just when it's in that early stages of it comes and it goes, and sometimes it'll hurt, sometimes it won't, sometimes it'll stop you from doing certain things, but not everything. You can push through it. That's the time to get it treated. That's the time to get it looked at. That's the time to determine the cause and fix the cause. Because then it will eventually get worse to the point where it is constant pain. It does interfere with everything. You can't do everything. And by that time, you know, a lot of times there's a lot of damage that has been done, and it's really hard to reverse a lot of that. So it's important that you always catch something early. When you have numbness and tingling, don't ignore it. Get to the doctor, you know, come in. We do offer a free consultation. All you have to do is call our office at 215-997-9898, and we'd be happy to get you in. But find out why you have that pain going down your leg. Don't ignore it, okay? Chronic pain, most of the time, has nothing to do with a major accident. It has everything to do with just ignoring the pain. So what can we do to eliminate sciatica immediately? So we're going to talk first about the one thing nobody likes to talk about, and I get eye rolls. This is posture. Posture. You're kidding yourself if you think you can continue to have bad posture and fix your sciatica. So a lot of times when people are like, I'm just so frustrated, nothing's working, and you know, I can't fix in an hour what you go in 23 and destroy. So it's really important that you know that posture, sitting, standing, all the postures that that you do really play a part in back pain and sciatica. So if you're kind of curled up in a ball on the couch at night watching TV, or you sit at your desk for 8 hours and hardly ever get up, and when I say hardly, if you're not getting up every 15 to 20 minutes, there's a problem. That interferes with posture. That causes back pain and sciatica. So it's important that you have your desk set up properly, desk or your favorite area set up properly. You want to make sure that you aren't sitting or standing for more than 20 minutes. 20 minutes, okay? And that when you go and you're done with your posture, or you're done with your desk work, you're not going to just curl up in the fetal position. So watch your posture during fun activities, like sitting on the bleachers, watching your kids play sports, sitting there watching TV, laying in your bed. I get a lot of photos of people. I ask people to send me photographs, almost photobombs of the, you know, when their spouse is like, I'm frustrated, nothing's getting better. I'm like, find the spot that they're always in. And usually I get something along the lines of this. Oh, well, no wonder your back's not getting better. All right, so there is no magic pill, there is no stretch, there is nothing that's going to help your sciatica if you don't fix your posture first. If you don't consistently move from sit to stand during the day. You are not meant to sit for an hour straight. You are not meant to sit for 2 hours straight. You are meant to sit to stand. You see how much I move? I'm standing at my desk. I'm constantly shifting back and forth. We were meant to move. That's what keeps our muscles healthy. That's what keeps our joints healthy. So really important, don't kid yourself. It's a longer process, I understand. Again, you can see all of this, how to set up your desk, on our YouTube channel, but it's really something that's important, and you cannot get relief without it. All right, there's no shortcuts, there's no way around it, and if you haven't gotten relief, and the things I'm going to show you don't provide you relief, it's because a lot of times this is not working. All right, so we're going to do the figure 4 stretch. So this is going to help with some tight muscles, all right? So this can be done a number of ways. I do this all throughout the day, all right? So you have your figure 4 stretch. All right, so you can do this one on your back, on your standing up, sitting down, all right? So I'm going to show it to you standing up. because that's the way I most often do it. But you can do this while you're sitting at your desk. It's super easy to do, very inconspicuous. When you're standing up, you want to find something that's a good height to lift your leg up, and you want to have your leg resting on the table. A lot of times when you have sciatica, you're going to have your leg up like this. You're not going to be able to lay it down on the table. Okay? You want to square off your hips, keep your back straight, and lean forward. You're going to feel a stretch maybe in your low back, maybe in your butt, maybe in your hamstring. It depends on where you're tightest. So just be aware that everyone's not going to feel the stretch in the same spot. It's going to go back to where you're tightest at. All right, so you're going to lean forward nice and easy. Again, if you collapse like this, one, you're doing yourself no favors. Two, your posture, like we just talked about. And three, you're not getting the stretch that you need. So everything has to stay straight. You're going to hinge from the hips, and you're going to bend forward. You're going to stretch that muscle out. Again, you're going to feel it either in the glute, in the hamstring, in the low back, wherever you're tightest. You want to hold that 30 seconds, and you want to do that 6 times. Because that's a stretch, you want to do that throughout the day. If you're sitting at your desk, all right, just cross your foot just cross your ankle over your foot and lean forward. One of the easiest ways to see how dysfunctional your hips are, your sciatica is, if one leg stays up like this and then one knee rests like this, you have a severe problem on the other side. Just very easy. Now what it is, I don't know. You're going to figure that one out. But again, you're going to sit here and you're going to lean forward. You can do this during a meeting. This is something that needs to be done throughout the day. Don't just do it once and think that's great. You're going to have to do that constantly throughout the day, as well as going from sit to stand. The next thing you're going to do is we're going to do some back extension. All right. Now this is more going to give you relief if you have some of those disc issues. If this is more of a sciatica coming from a herniated disc. So you're going to put your palms flat on your low back, okay? And all you're going to do is lean back as far as you can and then come forward. If you get any increased pain with this, any pinching, anything like that, stop. This is not the stretch for you. But you're just going to put your hands on your back and then lean backwards and then come up. And then lean backwards and come up. You want to repeat that about 15 times. Nice and easy. Go slow. You don't necessarily have to sit back here for 30 seconds, okay? You just want to go nice and easy, forward and back. All right? And that, again, should help if you have more of a herniated disc issue from sciatica. And the final stretch you want to try and do, and this may be most challenging, and if you can't do it, you can't do it. But we're going to work on a hamstring stretch. All right? Now, if you really have pain going all the way down your leg, you actually might feel some tugging on that nerve, and this may be a little bit too painful. So we're going to do a little hamstring stretch. We can turn the hamstring stretch into a little bit of a nerve glide. So you're going to put your foot up on the table. Now chances are if you have sciatica, you're not going to lift it that high. Not that this is high, but this is high for someone with sciatica. You want to keep that leg straight. You want to keep your back straight. Now, if you might have a lower stool that you can put this on, and this is just too much. You can bend your knee a little bit, or you can put this on a lower stool and you can actually point and flex your foot. It's going to allow that sciatic nerve to move through the tunnels where it might be getting caught, okay? You don't want to do this and have like pressure on this leg, otherwise you're going to be, your balance is going to be compromised, but you want to have all the pressure in the other leg, and you can either stretch, where you stand up nice and straight and then lean forward, or you can point and flex your toe, turning it into more of a nerve glide, which will help break up some of that tissue tension in your sciatic nerve. But either way, if that is just too painful, and when you put your foot up on anything, you get shock syndromes, where you get that shock sensation. First of all, you need to see somebody immediately, and second of all, don't do it. If you or someone you know is suffering with back pain or sciatica and wants a free consultation, all you have to do is call our office at 215-997-9898, and we'd be happy to get you in. Thanks, and have a good night.